Hi, I'm Julia Haller. I'm the ophthalmologist-in-chief at Wills Eye Hospital, and I'm here at the Wills Eye Alumni Society newsroom with two of our outstanding residents who have just given two fabulous presentations at our weekly Chiefs rounds, Brent Finkley and Tim Arlo. So we'd just like to talk a little bit about the interesting cases that were presented today. Tim, let's start with you. This is your first Chiefs rounds. How was it, and what was it like? And tell us about your case.
A little bit like a roller coaster. To say I was anxious is a bit of an understatement. But the most amazing thing was I just had senior residents coming up to me and just stopping me and saying, "Do you need any help? Do you have any questions? Do you have any concerns?" And so everyone was super helpful, and
That's great.
It was a really great sense of camaraderie.
Explain a little bit about the format of Chiefs rounds for people who may not be aware of it.
So Chiefs rounds is you basically get up and you present a case and to a number of experts, and the idea is we walk through the case, and as we do so, we ask them questions, and we look at the different either films or images from the patient and different lab work, and come up with differential diagnosis, how we think about it, and how we approach treatment and workup.
So it's kind of like a Sherlock Holmes mystery, where you start out with the case and then you unravel it. And what's distinctive about the Wills Chiefs round format is that, unlike other types of scenarios where the faculty will be quizzing the residents, in this case the resident is quizzing the faculty. So tell us about your case, Tim.
So I discussed a patient who ended up having some visual field defects, and from a number of different ways we ended up identifying she had Neuromyelitis Optica.
Tell us a little bit about how you found the patient. What do you mean? Where did she come from? Because a big source of the patients that are interesting cases here, I think, have a similar entree into our system. And number two, what is that disease?
So the patient was referred by an outside ophthalmologist to Wills, and we saw her here. Neuromyelitis optica itself is thought to be a subset of MS in the past, but now it's known to be a distinct entity in and of itself. Recent radiographic, immunologic, clinical, pathological data support that it's its own disease entity. It's mainly, the result is a demyelination of the optic nerves and spinal cord, and can present in symptoms similar to MS, but with a number of different ophthalmological manifestations, notably visual field defects, decrease in visual acuity, and decrease in color perception.
And is there a pathognomonic finding on any of the lab work that really clues you in as to what's going on?
The antibody test, the antibody against the aquaporin 4 channel, that's a highly specific test, so very, very low false positive rate for that.
Great. Great case. Next was Brent Finkley. Brent's here with his gator tie today. Brent, tell us about how we found your case and what that was all about.
So as you mentioned, a lot of these cases come through similar channels, and so many of them come through the emergency department, but a lot of them do get referred over to us, and so this was a challenging case of SturgeWeber Syndrome and glaucoma management, which was referred to our pediatrics clinic from an outside ophthalmologist after some initial therapies. So we pulled the case when he then began complaining of this proptosis on one side due to the unusual nature of that.
So the case of the bulging eye, it does sound like a Sherlock Holmes mystery. What was the source of the bulging eye?
So that's what we wanted to get actually many different experts' opinions on, because we saw the child in pediatrics. We saw him again through the resident clinic in plastics after he'd had imaging done. It's sort of a multifactorial thing. While the child did have these large encapsulated blebs from his glaucoma filtration procedure, multiple glaucoma filtration procedures, he also had some engorgement of some of the musculature due to the increased venous flow through there. So it's multifactorial, maybe a slight bit of globe enlargement, but not one large mass we could hang our hat on. So then the next question becomes, well, how do you treat that when you don't have sort of a single thing to go after? And that's what we really appreciate having so many different experts' opinions on in one place at one time.
Great. Well, a great morning with a lot of interesting discussion of two great clinical cases. I'm Julia Haller here in the Wills Eye Alumni Society newsroom with two of our outstanding residents. Thanks so much for being with us.